My name is Cam and I am a medical education specialist. I will serve as your guide as we cover the information in today's video. This video is meant to help you better understand your pain medicine, including the benefits and risks of taking pain medications, what side effects might occur when taking these medicines, what can be done to help prevent or relieve certain side effects, how to use your pain medicine safely and responsibly, and what questions you would need to discuss with your doctor about your pain medicine.
My name is Adam Gumersheimer, and I'm a pharmacist. Not all medicines for pain are the same. Some are stronger and work differently than others. Today, we will learn about some of the benefits and risks of taking pain medicines, as these are especially important to consider when using these medicines for long periods of time. It is important to know that some medicines used for pain do not completely eliminate pain. Instead, these medicines help make your pain more manageable. While you may still experience some pain while taking your medicines, hopefully the pain is less intense. Pain medicines can lessen the impact of pain on your day-to-day life. The goal of using pain medicine is to help you manage your pain so that you can continue your usual daily activities. This may help you improve your family and social relationships, as well as your overall functioning. Some medicines may also help to slow physical deterioration related to your condition. This means that you may be able to do things that you like to do for longer periods of time without the pain bothering you like it once did. Because some pain medicines carry the possibility of serious side effects, including dependence on the medicine, your doctor will likely need a medical history and physical exam before prescribing pain medicines. At your follow-up appointment, he or she may ask you questions to make sure that your medicines are being used safely and responsibly. There are a number of risks you will want to be aware of when taking pain medicines. Some pain medicines are addictive. If becoming addicted is a concern to you, you should talk to your doctor. Your doctor might talk to you about some non-addictive treatments if there is concern that these medicines might not be safe for you. Your doctor can work with you to find an option for controlling your pain that is right for you. If you use pain medicines regularly, you might feel unpleasant when you stop taking your medicine. Some of these unpleasant side effects might include restlessness and trouble sleeping. This happens because your body becomes dependent on the medicine. These unpleasant feelings are normal and will go away a few days after stopping the medicine. People may respond differently to certain pain medicines. Not everybody taking the same pain medicine will get the same pain relief. Some people will also experience more side effects than others. It's important to talk to your doctor after starting your pain medicines to check for side effects and to ensure that the pain medicine is working for you. Your doctor will work with you to help you decide if continuing the medicine, adjusting the dose, switching medicines, or discontinuing the medicine is the right option for you. When your body gets used to pain medicine, it is possible that your dose might need to be changed to give you the right amount of pain relief. Make an effort to monitor your own pain and to take note of how well the pain medicine works to control your pain. Be sure to talk to your doctor if you notice any changes.
To help you better understand the risks of pain medicine, we will now hear from patients who, like you, live with chronic pain. These patients will share their experiences they have encountered while taking their medicine.
When I first started taking my pain medicine, I felt really drowsy. I couldn't even drive myself to work the first day. Even when I tried doing other things like cooking dinner for my family or doing my crossword puzzles, I still felt a sort of cloudy or fuzzy feeling.
When starting your pain medicine or increasing your dose, it is common to experience drowsiness. You may even have a fuzzy feeling that makes it difficult to concentrate. While experiencing these effects, it is recommended that you avoid driving and working. You should also be more cautious to avoid falls. The drowsiness and difficulty concentrating will usually lessen over time.
Now that I've been taking my pain medicine for a few months, I don't feel nearly as drowsy. I can even take my medicine and then go to work. But I still have to be careful when taking other medications at the same time. There have been a couple of times that I've become extremely drowsy after taking my medicine, and I was not expecting it. On one such occasion, I had taken some medicine for a cold at the same time as my pain medicine.
Always check with your pharmacist before taking any new medicines. Even medicines that you can get at your local drugstore may contain ingredients that make your drowsiness more intense. When taking these medicines at the same time as your pain medicine, the drowsiness that can result may make it unsafe for you to drive or to work and may increase your risk of falls or injury. You should avoid alcohol, marijuana, and street drugs when taking your pain medicines, as these can also increase drowsiness. Now we hear from another patient who has different experiences while taking pain medicine.
I usually have 2 beers in the evening with dinner, so I didn't think anything of it when I started pain medicine. I took my medicine and had a couple of beers with dinner as usual. Shortly after, I was so drowsy I couldn't manage to do anything else that evening, and my wife said she couldn't even tell if I was breathing or not after I had fallen asleep.
A serious and possible deadly effect of pain medicines is a slowing of the breathing. This effect can be very dangerous if the dose of the pain medicine is large enough, or if the pain medicine is combined with alcohol, marijuana, street drugs, or any other medicines that can cause drowsiness. Always check with your pharmacist before taking any new medicines and avoid alcohol and street drugs. These substances, when combined with your pain medicine, can slow your breathing to an unsafe rate. If you have any questions about what side effects your medicine might have, that is a very important thing to bring up with your doctor at your next appointment. If you're experiencing something unusual, your doctor will be able to tell you if it's related to your medicine or if it's something else. Do not hesitate to mention things that might be bothering you, even if you're unsure what the cause is. Taking your pain medicine for long periods of time may lead to rare side effects that we will not address in this video, such as chronic tired feeling and loss of sexual interest.
Good morning, Melissa. I know that we recently increased your pain medicines. I just wanted to talk to you and see how things are going with that.
My pain bothers me even less now. I'm able to play with my children without really thinking about it.
Good, okay. What else have you noticed that you might be concerned about?
Just the usual drowsiness. I feel like I'm in a daze sometimes.
It's good that you mentioned that. Drowsiness, confusion, or just kind of feeling fuzzy can be expected when starting these medicines or if we ever increase the doses. This will usually get better over time. Just be careful for now to avoid driving or working in these conditions, and be more careful to avoid falls. Have you been started on any other new medicines? Anything that's even over the counter?
No, just the vitamins I told you about last time. Usually just one.
So it's going to be really important that you talk with your pharmacist when you start any new medicines, since you are on these pain medications, even medicines that are available over the counter. Because some of them, like Benadryl, can worsen the drowsiness that you're going to feel with the pain medications. It's also important to know that alcohol, marijuana, and street drugs can make your drowsiness worse, and so these should be avoided when you're taking these pain medications. Have you noticed any changes in your bowel movements?
Well, yes. My stools are small and hard. They're very uncomfortable to pass, and I don't go very often, but I didn't think of this as having anything to do with my pain medicine.
Constipation is a really common side effect of these pain medications, and unlike the drowsiness that you mentioned, the constipation will not go away over time. So it's going to be important for you to do some things to help relieve that constipation. Staying hydrated by drinking plenty of fluids and water will help. Increasing the fiber in your diet will help, and also increasing exercise can help. If these initial measures don't help, then we can look at medications to help the bowel movements be more regular. Another side effect that people experience with pain medicines is this queasy feeling that may or may not be accompanied by vomiting. Usually this occurs when starting the medicine, switching to a different pain medication, or increasing the dose. This will usually get better over time. Have you had any trouble with nausea or queasiness?
No, I haven't.
Well, good. Okay. I'd also like to talk about another potential side effect, which is itching or developing a rash. It's really important that if this happens that you talk with your doctor or your pharmacist.
Okay, I didn't have a rash, but I'll keep that in mind.
Well, this all sounds pretty good, Melissa. Sounds like you're getting along pretty well with this pain medications. Just like to ask you a couple more questions. Do you get all your prescriptions taken at the same pharmacy?
Yes, my husband and I always use the pharmacy closest to our home.
Good, good. I always recommend this to my patients. It's important to get all your prescriptions from the same pharmacy so that your pharmacist can be checking for any interactions between the pain medicine and other medications that you may be taking. Where do you store your pain medicines at home?
Just in my bathroom cabinet with my other medicines.
I usually recommend that it's best to store all your pain medications in a cool, dry place. The most important thing I recommend regarding these medicines is that you store them in a place that's safe and out of the reach of children or pets. This may even mean that you have to keep them in a locked medicine cabinet. Melissa, what other questions do you have for me?
I think we've covered everything I was concerned about.
Great. Well, if anything new comes up, please don't hesitate to call the office. If not, I'll see you at your next appointment.
We want to make sure that you're safe while taking your pain medicines so that you can get the most benefit from it and avoid those risky side effects. Keep these tips in mind to keep yourself safe while taking your medicine. Always take the prescribed dose. Avoid alcohol and street drugs while taking your pain medicine. Inform your doctor or pharmacist before taking any new medicines. Store your medicines away from pets, kids, and others. Do not let anyone else use or borrow your pain medicine. If you are going to stop taking your medicine or you feel like you need an increased dose, discuss it with your doctor first. Get all your prescriptions filled at the same pharmacy.
Thank you for viewing our video today. I hope that you better understand your pain medicine and that you will be prepared to discuss your medicine with your doctor at your next appointment.